Constipation. Normal stool habits depending on the age, diet and other factors are variable. Constipation lasting for more than 4 weeks is called chronic constipation and has an objective criteria. Constipation less than 4 weeks, that is acute constipation, may be simply defined as a recent problem with defecation, delayed or infrequent passage of hard stools with pain, excessive straining, incomplete evacuation, involuntary soiling or inability to pass stool at all. So for the criteria of chronic constipation, there should be more than or equal to 2 or following occurring at least once per week for more than 4 weeks. It could be either defecation frequency less than or equal to 2 times per week, fecal incontinence more than or equal to 1 time per week after acquisition of toileting skills, history or excessive stool retention, history of painful or hard bowel movements, presence of large mass in the rectum or history of large diameter stools. Causes of constipation can be various like surgical, neurological causes, metabolic causes, gastrointestinal causes, dietary, toxic or functional constipation. Evaluation of the patient with constipation, we should go with the clinical history and examination. We should look for the red flag signs and we should manage them accordingly. Coming to the treatment of constipation, the treatment of constipation is having two phases. They have two phases: disimpaction phase and maintenance phase. Disimpaction is done with the first line drug is polyethylene glycol, the high dose polyethylene glycol of 1.5 to 2 gram per kg per day in 2 divided doses for 3 to 6 days. Then which is followed by a maintenance therapy with osmotic laxatives like polyethylene glycol itself, starting with the dose of 0.5 gram per kg per day in children more than 1 year of age. For children less than 1 year of age, lactulose is preferred at the dose of 2.5 ml BD. This maintenance therapy is recommended for at least 2 months, and the child should be symptom free for at least 1 month before discontinuation of this maintenance therapy. If there is a perianal itching or fissures are present, so local perianal care is required, and that may relieve the painful defecation and decrease the stool retentive behavior. Toilet training is also preferred in the age group of 3 to 4 years of age. The rule of 1 is followed for toilet training. That is, one person follow one routine, that is, make the child sit for 5 to 10 minutes in the toilet within 30 minutes of each major meal, one place, and use one word such as poo or potty. Appropriate angulation of the knee and thighs to facilitate the expulsion of stool can be achieved by squatting in an Indian seat or using a footrest in a Western toilet seat. Dietary and physical activity, the high fiber diet should be given to the patient. Then diagnosis of constipation is primarily clinical based on history and physical examination, and routine use of abdominal radiographs is not recommended unless